The eyes are the window to the soul, and that doesn't just mean for humans, it also means for our pets. Hence the reason to make sure our pets go to the eye doctor, the vet. That's the topic for this week's visit to Dr. Andrea Dennis at the Bloomfield Animal Hospital in Bloomfield. We get to meet Tallulah for her eye exam. Take a look.
I'm so sorry.
What a cutie! This is Tallulah, the French bulldog, or Frenchie for short, visiting with Dr. Andrea Dennis at the Bloomfield Animal Hospital in Bloomfield, just to make sure her eyes are A-OK. Hi everybody, we're here at the Bloomfield Animal Hospital. I'm with Danny, nice to see you. I'm with Tallulah, nice to see you, Tallulah. And of course, Dr. Andrea Dennis, and we're so happy to be here. Today we're talking about eyes.
Yes.
Okay, so tell us a little bit about what could possibly go wrong and how you would go about fixing it.
Good question to start off. The eyes, obviously, we call them the soul to the heart, the soul to the world, and they tell us so much about our guys, our kids. Sometimes you just look at them. First thing you want to make sure is both eyes look the same, they're equal in size. And you just kind of look at the white of the eyes and make sure they're white and they're not yellow, because sometimes that can be a sign of a liver problem.
Okay.
They're not red, and that can sometimes be a sign of just we've got irritation, or even sometimes an infection will show up as redness in the eyes.
Okay,
So, and then they just have specific eye conditions, anywhere from glaucoma to corneal ulcers. So we have to do specific tests when there is an eye problem. Now, we examine their eyes every time they come in. That's just part of the exam.
Okay. Because at home, I don't know if I'd be able to pick up on an eye disease, but that's why it's so important to get to the vet.
Right, it is, and we can catch things early. Some of the things that people do feel that they can see at home is when one eye is like, they're winking at you, you know, like that. One eye is more shut than the other.
Okay.
Then that's an absolute problem, and we consider that an emergency. If your pet cannot open one of their eyes, then that's a problem. You need to call.
Now, no one's looking at his eyes, they're looking at his tongue. Because it's the cutest dog. Looking at
her tongue.
Looking at her tongue.
Part of this is her breed. She's a brachycephalic breed, again, which means that basically their head is wider than it is longer. They do tend to have some of that undershot jaw. You see how her jaw comes out more than her upper level, her mandible. So that's part of he also pugs are brachycephalic, Persians are brachycephalic. So this is part of who she is as a Frenchie, right, sweetie? The narrow nose, and they're more prone as a group of breeds to eye problems because their eye sockets are more shallow.
Okay.
So their eyes are a little bit more prominent. They kind of come out at you a little bit more. So just like anything else, if something is exposed, it's more likely to get irritated. It's more likely to get scratched. And then we also know that they tend to have some eyelid problems as well. And the most common thing that we see is where the eyelid kind of rolls in a little bit. I can unroll hers a little, and just in that what we call the medial canthus, and that's really putting her eyelid where it should be. But hers is not bad. It's there, but it's not bad, is it? The other thing we do is first just look from afar. Then I'm going to do an exam that's going to look at the back of her eye, look at the lens of her eye, make sure there's no swellings on her optic disc. And what I'm looking at right now is her retina, and her retina is greenish. And you know where at night when your headlights shine on an animal and you see that glow? That's a reflection of the retina. So if we put a light on her, you would see this beautiful kind of aqua green coloring. That's the color of her retina.
And that's a good sign?
It's a great sign, and she looks beautiful there. Then the other thing, you've heard of cataracts. We also look at the lens of her eye. Her lens is beautiful.
Dogs don't get dogaracts?
No.
They get cataracts.
Yes.
Okay.
Yes, Scott, they do.
Okay.
And cats get cataracts too.
Cats get cataracts too. Next, Dr. Dennis numbs Tallulah's eyes and checks for glaucoma.
All right, so we talked about looking for glaucoma, but it's so good in our younger dogs too, just to get a normal baseline. What is her pressure in her eyes? So this is going to be our tonometer, and I'm just going to have her, let's try this eye here. I think hopefully that'll be good. And I'm going to tap this several times. She doesn't feel it. Her eye is numb. And we have a pressure of 19, which is perfect.
19.
19. Anything under 20 I'm really happy with, so that's 19. So that's normal.
Tallulah's other eye checks out great too.
Do you know how often should you get an eye exam?
Annual exam. Again, with these group of breed, the brachycephalic breeds, I would do it twice a year.
Okay.
And especially if they're older, 6 years old, I think that's really important to do that.
Another test Dr. Dennis performs is called a flora seed stain.
Come here, baby girl. I'm just going to put a little drop right on her eye, right there. See how that's nice and yellow?
Okay, now what is that doing?
That's going to tell me if she has any scratches on her eye or any ulcers. If that cornea, which is the clear part of the eye, has any breaks in it. It needs to be as smooth, so technically this should be negative, meaning I don't want to see any of this. Now I'm going to shut off the light if we can.
We turn the lights off and Tallulah's eyes are glowing.
So this is called a woods lamp, and see how that eye glows? So I am going to look at that eye and see, is there any scratches? You think I have a treat for you, don't you? No, they look good. They do. I can tell that she does have a little bit of that, a little bit of those eyelashes rubbing her, but her corneas look fantastic.
All right, so that's the eye exam from Dr. Andrea Dennis. Danny, thank you so much for your assistance. And Tallulah, you look so good. You can see clearly now.
So
what
many
a
things.
good dog.
I know, such
She's
a great
so
dog.
sweet.
Tallulah's awesome. All right, now if something were wrong with Tallulah's eyes, Dr. Dennis can do several different things to remedy the situation, from a simple eye drops to medication to possibly a more complicated surgery, depending on what's wrong. But the first thing you need to do is make sure you get that annual checkup with your vet, so just to make sure your pet's eyes are good to go.
You can always reach out to Dr. Dennis with any of your pet questions by going to Bloomfield Animal Hospital, CT.com. She's also on News Talk 1080 every other Saturday talking about her pets as well. And thanks, Doc.
Yeah, thanks. We're grateful for you.